So, premium intraocular lens. I do worry about the word premium because it makes it sound like if you throw money at something then you're going to get the best possible outcome. But not every premium lens is right for you. It all depends on your circumstances, and it's important to understand whether you're still working or not, your hobbies, tennis, golf, things like that, and what your visual requirements are, your visual wish list. We can't work miracles. We can't restore you back to the stage you were at 18, whereby you could see the distance clearly, near clearly, without any issues at all. There are compromises. Now, premium lens encompasses lots of different non-standard lenses. So the ordinary lens, the monofocal lens which you get on the NHS, just sets you for distance. Now, we still use that lens in the private sector because it's a very good lens and a lot of the patients are perfectly happy with that. But the problem is when we try and set you for distance, you can be left with astigmatism, you can be left slightly long or slightly short-sighted, and we set you for one distance. So by the name of it, it's a monofocal lens, so we focus the light for one distance, and that is usually distance. That means your intermediate and near vision can be compromised. Now, that didn't used to be a major problem because people used to wear reading spectacles for their reading and just walked around with minimal spectacle correction for distance. But in the advent of the electronic era and laptops and mobile phones and things like that, people are getting frustrated because they can't see their mobile phone or their laptop without getting spectacles out, and that frustrates them. So there are lots of options that we can do to try and achieve something better for you. There's a whole myriad of lenses, and your surgeons will have personal preferences and they'll have personal opinions on the different lenses which they use. And a lot of it is based on experience. I'm an old boy now and I'm long in the tooth, so I've had a lot of experience with lenses, and I've picked the ones that actually give my patients the best outcome in my hands. So I can't give you precise judgments on different lenses because your surgeon is the one who knows better about it. They will be able to tell you what lenses they use. They'll be able to tell you the pros and cons of them. But I'm going to briefly describe the different sorts of lenses that are out there. So toric lenses first of all, and there's a separate talk about astigmatism. The toric lens is correct astigmatism. So if you're going to have a distance correcting lens and you have residual astigmatism, then your vision will be blurry without spectacles on. With spectacles on, you'll still be happy, but your vision may be blurry. And we have the opportunity to put toric lens in the eye, where we take the astigmatism, the rugby ball shape of the cornea, and actually put it in the eye itself. We orientate it at 90 degrees to cancel out the astigmatism of the cornea, and hopefully that will give you good, unaided distance vision. So that's a toric lens, that's a premium lens, and I suggest anybody with an astigmatism above 1 diopter needs to have a think about it. If you're more than 2, then I certainly think the visual quality will be markedly improved by a toric lens. You're going privately anyway. If you're insured, then they may not pay for the premium lenses, but if you're self-paying, then I think it's a reasonable thing to do, and I would encourage you to certainly discuss that with your optician, with your surgeon. The actual lens itself, your prescription will give you an idea of your astigmatism. The first number is your long or short-sightedness, so plus is long-sighted, minus is short-sighted. The second number is your astigmatism. If that's more than 1, then potentially you could benefit from a toric lens. So if we go to the next level, then people are searching for distance and intermediate vision as well. In this circumstance, there are lenses called extended depth of focus lenses that are designed to give you that by focusing light to different places. Now, usually they focus the light to 2 main places, distance and intermediate. That should hopefully allow you to walk around without your spectacles on and see your dashboard, see your computer, see your phone without spectacles on. There are problems with these extended depth of focus lenses, but your surgeon will be able to discuss them with you. They mostly work on diffractive principles, whereby there are concentric rings on the cornea and they focus the light in different places. But it's like a lighthouse lens. If you notice the rings on there, you inevitably get some degree of glare, and glare can be a major problem. By splitting light energy off, we're reliant on less light energy as well. So whereas usually with a monofocal lens, you get 100% of the light energy set for distance and you can see everything, we've got to rob Peter to pay Paul. So we've got to take some of that light energy and divert it to somewhere else. Often I tell patients it's a compromised vision. And if you're happy to compromise vision to be spectacle independent, then I'm happy to do it for you. But you have to go into it with open eyes and realise the downsides as well as the plus sides. Your surgeon will have different views on this and different lenses they use, so I'm not going to talk about specific brands. There are bifocal lenses as well, which don't have the concentric rings on and have 2 areas, effectively bifocals inside the eye, and they set you for distance and near by splitting the light energy off 60-40. But you're reliant on only 40% of the light energy which you had before for near, and in the majority of people, that's absolutely fine. And I've had fantastic patient results with it, but in some patients it's not the ideal thing. So again, it's all about you. All about what you want out of it and the downsides you're prepared to accept and the downsides you're not prepared to accept. So it's important you have that discussion with your surgeon. There are multifocal lenses. Often, again, these are based on concentric rings whereby we focus the light at different places. And often we focus distance, intermediate and near, so 3 focal points. This is effectively the holy grail of vision, giving you good distance, intermediate and near vision without spectacles. But as I mentioned before, nothing is as good as when you're 18 years old, and so it's important you discuss this with your surgeon, because there are significant downsides, including glare and reduction in light intensity, that you have to understand, be able to accept, and also there's some degree of cerebral adaptation that takes place. The lenses out there are fantastic. They wouldn't be out there if they weren't proven and had stood the test of time, but there are downsides, and not everybody is happy with those lenses. And because it's a partnership approach between you and your private surgeon, you need to have that discussion with them and make sure that they understand your wants and needs. They need to answer your questions as to why they want that lens for you and what it's all about. And hopefully in that partnership approach, you should achieve a fantastic outcome. But keep your expectations realistic. The last sort of premium lens is the premium monofocal lenses, which I'm actually quite a big fan of. They're designed to give you distance vision and some degree of intermediate vision. And there's a whole separate talk on this, and another video. But the aim is that they give you the benefits of intermediate vision without the downsides of light energy loss or the glare or the diffractive process. They do not give you distance and near vision without spectacles, but they can help you, particularly if we offset you and leave one eye slightly more short-sighted than the other, then people can achieve reading vision without specs on. But again, it's a compromise because we have to set the eye slightly different. Beware of premium lens name, makes it sound like it's fantastic, and a lot of them are fantastic, and a lot of them do give you fantastic vision without any side effects. But there are some issues that can occur, and that's why it's important you pick your surgeon, and that's why it's important you discuss it with them, and they'll know everything about it because they've been doing it for ages, and they will have their favourite lenses, give you information, and the brand of lens itself doesn't matter, it's the nature of the lens itself. But there are some fantastic lenses out there, and I wish you all the best with them.